Welcome back to the Coleman Nation. I'm Michael Coleman, your host, and heck yes, I want free healthcare. Let's talk today about how we could actually accomplish that, and I don't think it's going to be in the direction that you think it is. So stay tuned on this next episode of the Coleman Nation. So today's episode, I'm just a little, laughing about it to myself because I sit here and I think, man, who doesn't love free stuff? And I think about the fact that, would I love to have free healthcare? Absolutely. I think that would be the greatest thing ever. There's kind of a running joke in and around, stuff, which is, you could go to the UK. And part of the problem is if you go to the UK's health system, you're going to wait like a year for a surgery that you need tomorrow. So it takes too long. You go to America, and it completely bankrupts you if you wanted to get healthcare, and it's going to cost you too much. So you're going to be completely broke, and you're going to get smashed in their credit system, and completely destroyed financially. But hey, they got great healthcare, and you can get it quickly. Or you can just go to Canada, where you can just very quickly be seen by someone that's the medical assistance in dying. So basically, government-sponsored suicide, and that's the healthcare that you have to look forward to today. But I'm in all seriousness, I think that the concept of free healthcare is something that people they want. They want to be able to know that if something happens to them, that that society is in a position where it can take care of people that are falling ill. Now, I'm not even going to get into, the entire broken system that is, the sort of cradle to grave structure that is set up in order to make people sick by feeding them things that are not good for them. So they're born, they get hooked on sugar as kids, they grow up, they experience obesity, cancers, various different types of things, and then they go into adulthood, not to mention that they get diagnosed with all kinds of, of things that could be very easily fixed with, some simple lifestyle changes, but nobody wants to talk about lifestyle changes. No one wants to talk about, let's get rid of sugar. Let's get rid of junk food. Let's get outside. Let's look, don't look at the sun, but get out in the sun and actually start to get some exercise, physically take care of yourself. These are the things that, would cause people to be healthy, and then to rely less upon the quote unquote, the healthcare structure or system. But, carry that all the way through. And now all of a sudden, you're depressed and you're in your 20s and 30s and 40s, and you're stressed out at work, and family is going crazy. And now you're an old person, they're keeping you alive, and, you got various stages of dementia or Alzheimer's. And this is what I'm talking about when I say the cradle to grave, sort of is like, look, let's start you getting sick here, and let's keep you sick all the way through, because there's a lot of money to be made in the in between. Now, I look at that and I say, well, first of all, as a society, what do we got to do? We got to, like I said, get focused on getting healthy, like eating better. This starts with like really paying attention to the things that you put into your body. I remember reading a study, and again, I apologize, I can't quote you what it was, but the fact is that people are saying, like, what? Going through and, changing the way that we eat and the diet and all that kind of stuff, that would actually wind up handling most of the problems, the ailments that people have, could just be handled by diet, right? Adjustment diet, sleep, exercise, and a little bit of nutritional supplementation. That's it. Right? And I'm sitting there going, wow, that is so common sense. It almost hurts. It really does. But what we find ourselves in right now is we're in a situation, right? Where we have the ailing health of a nation, in fact, the ailing health of a planet, in my opinion, right? And we want to be able to make sure that we can be taken care of. And this is another quote that I had heard, is that anything that requires the work of another is not a right. Does that make sense? Anything that requires the work of another, so whether it's a doctor, a nurse, or any of the, various people that requires the work of another person, it's not your right. So I just want to get that out of the way right out of the gate, is that to say that healthcare is a right, well, under what circumstances does the work of another, is that owed to you for the life choices that you make? I'm just saying, you got yourself in a position that you're in right now. And again, this may be somewhat controversial, but I do want to make sure that, look, we got to wake some people up here. If you want to make some changes, you have to change, right? And you can't rely on, a magic pill or somebody with a certificate that's going to come in and be the superhero, for you at the last minute. But I get the point. And this is what I want to return back to, is that, is there a possibility to be able to get this, this sort of utopian concept of free healthcare? Hey, hopefully you're enjoying this content so far. If you are, please make sure that you like this video, that you subscribe to make sure that you don't miss any future content, and turn on the notifications so that you know when our upcoming episodes hit the airwaves. So there you go. Let's get back to our episode. But let's look at the answer to that question. Is I think that there is, but the path that we're going to take to get there, I don't think is going to be the path that you think that it's going to be. What have we done so far? It's like, look, let's tax the heck out of, everybody. Let's figure out, these various systems, whether it's Medicare, health insurance, all these different factors, Obamacare, whatever, and let's just figure out if we can sort of legislate our way into providing healthcare for the masses. And in all honesty, it's not worked. And you know who gets squeezed? I'm going to be honest with you. It's the people that are sort of in the middle class. Maybe you're making a few bucks, maybe you got some money that are saved up, but you go to the hospital, and I don't know if you guys, I think that there's more people have gone to the hospital probably in the last 3 years, than anything else, and I'll just kind of give you sort of my experience, of it was that, we wound up just during the, COVID-19, we wound up getting sick and said, okay, we got to go to the hospital. Let's go check this out, see, just want to make sure that nothing's too bad. I feel like a little sluggish, a little more tired than usual. It's like, I know people have reacted this in different ways. I don't want to overreact, but I also don't want to be, in a position where I don't, go in and at least get some guidance and whatever. So you go in, and, you get seen, someone comes in, takes your temperature, all that kind of stuff. And, said, okay, well, we're going to keep you here for some observation, maybe keep you here for a night or something like that. And, so we're in there, and then we get the bill, and I'm like, oh my gosh, like, this is $7,000 on a high deductible insurance plan. It's like $10,000. Like I'm going to be I'm out of luck on this thing. Right? Like I'm gonna have to pay this out of pocket, in order to be able to, because my deductibles are high. I said, well, that's kind of stupid. And then you go back to the hospital again, and one of having a gallstone episode, right? And so I go back in, I'm like, dude, I just this terrible pain, and then go back in. It's like, look, do a quick, MRI CAT scan. But what happened is that it wound up on the other side of New Year's. Right. And so I had to pay the deductible over here. So my insurance didn't even work over here. And then it comes on the other side of the year in the beginning, and then I got to pay it again. So in either case, I'm paying like tons of money out of pocket for a plan that my deductible I'm wind up having to pay anyway, And so I'm sitting there going, this is insane. And I had a situation, by the way, I'm a fairly healthy person. These are some very extreme situations that wound up, putting me in the hospital. But there was one situation that I had, and this was kind of a weird deal. I had something called a cough syncope. And this is something that, like, they say that that happens to like 1 out of like 50 million people. So there's like 5 or 6 people in the country that have ever had this situation. And what it was is I'd cough one time and I'd black out. Like it was just like, like that, literally a single cough, boom, I'm out. Right. And so if you can imagine, went to the doctor, had health insurance, all that kind of stuff. And I went to specialists. I went to get MRIs. I got CAT scans. I got brain scans. I got all these different things. And, went to see a zillion different specialists. I went to go see ENTs and all these doctors. And I remember that after the whole thing had occurred, and by the way, what it was it just said, listen, you got a little lesion on your throat, and what happens is it's connected to your whole the vagal nerve system, and so what happens is you have a cough and it reacts, and then boom, it just kind of turns your off switch on. Now this only happened to me for a very, very short period of time, and the doctor said, listen, you know what the solution is? Don't cough, and in order to not cough, you can't talk. So I literally had to spend months where I was not talking in order to be able to, that was it. That's the whole cure, was just to not talk anymore. Right. And so I stopped, let it heal. And sure enough, when they came back in, they took a camera, they showed me, I go, doc, I don't know what I'm looking at. So you got this sore throat. I'm like, okay, I've had a sore throat before. It's like, look, it looks terrible. And I was like, okay. And then he showed me again. And then it looked, I still don't know what I'm looking at. And then the third time he showed me, and I was like, oh, that's what my throat's supposed to look like. And so what happened is like my whole throat had constricted and I literally like couldn't breathe, So anyways, it was weird. It's all behind me and all that kind of stuff. It wasn't something that was permanent or lasting or anything like that. But what happened was that we went to go pay the bill. And my wife went in and she sits down and she goes to the administrator and says, okay, well, we need to square up. And it was like, and they're like, oh, it's like over $30,000, for these various tests and all the specialists and all that kind of stuff. I'm like, 30 grand? Are you freaking kidding me? And, and so the next thing, my wife goes, well, I need an itemized statement. I need to know exactly what we're paying for. And the lady goes, oh, are you guys paying out of pocket? And my wife goes, well, yeah, like, let's take a look. Like, what's the damage? We're going to send this in as a claim, or what are we going to do? And she goes, oh, well, if you're going to pay out of pocket, then that's a completely different pricing structure. And we're like, really? So if we didn't pay, if we put it as a claim in our insurance, it's going to cost us over $30,000. But because we're going to, potentially want to pay this out of pocket, what's it going to be? And I was like, oh, it's like $4,500. And we were just like, wait, what? Like, you're literally going to pay us, we're going to charge us $25,000 extra for this situation. And I'm sitting like, this is insane. Like, that's insane, right? That you could just basically stack on all of these things that no one's going to question, send it in for a claim, right? And then boom, it's going to get paid on your insurance. And I'm like, this is an absolutely broken system. Where does that money go? Where's the accountability? Like, how does this even work this way? That, that this hospital can just stack on all of these things, charge a completely different pricing structure. Like, I'm just going to tell you this right now. What's the amount of corruption that could be, part of that? If there's no accountability, you could just be shoveling through tons of things and be paying and all that kind of stuff. And I was like, this is a broken system. This is a broken system where there's no accountability. You don't know what you're paying for. You don't know how much it's going to cost. There's no fixed pricing. And there was something else that happened too. So that was the one thing that started to open my eyes to this whole situation, is like, what are we paying for? These insurances, like, they're broken. I mean, unless you're in a situation where you are completely, like, you're checked out of the system because why? You're covered by some big corporation, work for some giant company where it doesn't really matter anyway, or you're so poor that they have to see you, right? If you're anything like outside of that, you're a business owner, or, you're sort of self-employed, you work for yourself, I'm sitting there like, dude, like everyone else that wants the entitlement of free healthcare, they don't really understand what they're asking for or how it actually works. Because if it was, let me put it this way, if the healthcare system in America or Canada or the UK for that matter were completely efficient and accountable, I think that we could get there. I think that if we had an efficient, accountable healthcare system, we could actually wind up getting to a position where the surpluses or the expenditures within the government would actually be able to pay for healthcare for the broad public. Now, there's going to be outliers where it's going to be like, okay, well, a person with a heart or cancer or something, like very expensive to care for, but those are going to be the outliers. And by the way, if you start to raise the collective health of an entire country, if we were to like sort of create a situation where society looked up to and sort of, just took exercise and the things that I was talking about earlier, exercise, good diet, and sort of started putting that up on a pedestal instead of trying to get a quick fix for everything, then the question is could we raise the collective health level of an entire nation? I think that we could, but this has to start with ideologies. It has to start with pulling the vested interests and the people that are making so much ridiculous amounts of money on an unwitting and unknowing population. Like, we need to start becoming more aware of where the money is going and what is happening. Again, this could be controversial, but I think that this is the path in order to be able to get there. So let's continue down this road, right? Let's continue down this road because I think that, for you look at that, the people in the United States go, well, like they have free healthcare in other places, free healthcare in the UK, and free healthcare in a lot of the Scandinavian countries, and blah 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 blah. Herein lies the path to a solution. You look at the systems that you admire, you look at the systems that have pluses and benefits, and you go, okay, well, what are the minuses, right? What are the you look at the pros, it's free, but you look at the cons. Takes too long, right? I'm already dead before I even get an appointment. Okay. So you look at that, so let's take a look at the UK. Again, I'm not from the UK, so I don't know 100% how their systems work. But from what I understand, any UK resident can use the NHS, the National Health Service, in order to be able to, to help them without being asked to pay the full cost of the service, right? But here's the catch. The NHS is supported through taxes, and the income tax in the UK is high, ranging from between 20% to 45%. So these things are being subsidized, and so you talk about, free healthcare. Guys, there is no such thing as anything for free. Someone is paying for it. If the service is being done, you go see a doctor. That doctor has to deliver a service. They have nursing staff, they have administrative staff, they have technicians, they've got people that work there. All of those people have to be being paid. You going in to get a free checkup or free anything, those people where's the disconnect? The way that it's free is they're taking it from you in the form of taxes. Okay. And so, and by the way, there's other ways that they're taking it for you too, like in the situation of overcharging for lots of things on insurances. So between taxes and sort of, the insurance system, where there's very little accountability, lots of line items and things like that, that wind up getting paid X amount of dollars, and you can't even really see inside of it unless you ask for an itemized, statement. This is where it gets a little cloudy as far as, well, it seemed to be free. There's actually free, and then there's what seems to be free, right? And I was always taught, hey, there's no such thing as a free lunch, okay? An example that was, that's often cited is Sweden, where healthcare coverage is universal and automatic for all legal residents, right? But again, those same residents are paying for it, and they pay dearly, right? For the taxation in Sweden is considered to be some of the highest in the world. Personal income taxes range from anywhere from 29 to 35%. But there's also municipal taxes and a flat tax on capital gains of 30%. Okay, so you're sitting there going, well, Sweden's got free healthcare. It's covered. It's covered. Guys, again, there's nothing that's free. It's being taken and subsidized from somewhere. Okay, but my favorite example, and this is where we start to find, is there an actual solution? Could healthcare be taken care of by the government? And the answer to that question is yes. Now, who's doing it? Who's the example that I'm going to talk about? I don't know if you guys want to, care to offer any guesses right now before I give you the punchline. But the one country that seems to have pretty good healthcare, right, is Norway. Okay. Norway, if you were to look at their model, they are able to cover a lot of the costs of health insurance for their population. Okay. So they have, they're considered to have quality healthcare in Norway, and their coverage, their universal coverage is considered to be some of the best available in the world. Okay. But how are they paying for it? Again, there is no such thing as a free lunch. And there's two things. Okay. There's ways. Is that they have a combination of general taxes and payroll contributions by employers and employees. So as part of their work, they have employment taxes paid by the employers and the employees, and their general taxes. Okay, the income tax in Norway, from what I understand, is a flat rate of 22%, which that's on the low side. So hey, now we've got a winning combination here. Okay, subsidized a little bit by the employer, subsidized a little bit by the employee, right? And then we've got flat taxes, but you got some of the best coverage that's available. And their taxation, so it's pretty low taxes. Okay, but this is one of the things that you need to understand about Norway's economy. Okay, and this is where they are light years beyond the United States. Norway is debt-free, and they have a $1.6 trillion sovereign wealth fund. This is the highest in the world. This is what allows them to hedge against economic downturns and economic crises, is the fact that they as a nation are sitting on 1.6 trillion in reserves. Okay. So this is something that, people that have a socialist or communist bent are not going to want to hear, because what they want to hear is they go, I want everything for free, right? I want everything for free. Okay. That's not a realistic thing. Everyone needs to be paid for. Everyone needs to be paid for the services that they render. Okay. But I want you to imagine this, and herein lies the answer, is if the United States were completely debt-free, like we didn't owe anything, okay? So our debt was gone. Instead of what are we paying right now? We're paying $1 trillion a year in interest. We're paying $1 trillion a year in interest on our debt, okay? Like, don't get me started on, central banking and all that kind of stuff. But we're paying $1 trillion in interest. If we had no debt, right, then what could happen is that all of the money that we have that we would be paying towards interest on servicing our debt could actually be going to stacking our own, sort of U.S. sovereign wealth fund, a capital reserves for the entire country. That could be wind up, like if you look at, again, Norway as a model, they've got a tremendous amount of ownership in literally some of the biggest companies on the planet are owned in the Norwegian sovereign wealth fund. Okay. So can you imagine that we had a giant fund, the surplus would be being spent, the interest that would be generated on healthcare and other social services, and we had no debt? See, the problem is, again, in the United States, is that we have a lack of accountability where money can just be spent willy-nilly. If we really wanted to have a free healthcare system, we would have to be debt-free. In fact, I don't see any other path towards the free healthcare than to be a debt-free nation that has a surplus of income and has a sovereign wealth fund that the government basically has a capital reserves that is generating interest, and that interest is being paid back into society, and lowering the taxes across the board. If we had lower taxes, and I'm telling you this right now, go do some basic economic research, understand, like Thomas Sowell is a very good place to start. Understanding the basic economy of how the United States works is very important to understanding, like, wow, if we were debt-free, if we weren't funding, endless wars in other countries, if we had a capital reserves, we would have a surplus that would be able to pay for our healthcare. And we'd also be able to pay for all of the entitlements. And we'd also be able to pay for for people, for education. Like almost everything that we want to be free could be being subsidized if we were, number one, debt-free, and number two, had capital reserves that were generating interest. That type of stuff. Can you imagine how many trillions we could have in reserves and how strong this country would be if we were debt-free, right? And then we were able to subsidize these things, all of the social betterment programs, the things that we desire. And the whole point of it, and why we're not, is because of the inherent corruption and cronyism that's rampant in these types of systems. They're sort of self-fulfilling, meaning that the more money that you throw in them, the more people become dependent on it, which require more money to be thrown at them. And then pretty soon it becomes, this sort of this Ouroboros, the snake that eats itself. And so this is one of the things that we need to basically stop, is we have to stop the spending. We need to then increase accountability. And then as a result of getting out of debt is the next thing. And then not only that, but then having a well-invested, sovereign wealth fund for the country that can generate interest in order to be able to pay for these things. That is a huge, huge benefit. And in fact, I got to be honest with you, if these are the benefits that you really want, I really only see that as the only way forward in order to be able to accomplish that. I mean, correct me if I'm wrong. You cannot go into debt and continue to expect free things. Let's give an example. You have a cousin that borrows $20,000 from you. They never make any payments. They continue to accrue interest. Compounded over time, that $20,000 grows to $40,000. They never pay you. Then they say, listen, I need to, hey, cuz, listen, I know I haven't made good on the debt. I borrowed 20 grand. Now it's up to 40 because of the continued interest, but I need to borrow another 40 grand on top of that. I don't really have a plan to pay you, but, I know that I'm in a lot of debt. I don't have a job right now, but if you could continue to, loan me that money and just put it on my tab. Is there a world that exists, and I don't care what your background is, where you would continue to give your cousin just unfettered access to your money and yours? There's no world that would exist. This is the way that we need to start treating the budget and the government of our country is like, look, got to turn off that, we got to turn off the faucet of money, right? We got to tighten up the belt. We got to figure out what are the things that are the most required. We got to trim the fat. We got to increase accountability. And by doing this, we can actually wind up, creating a new system that would actually be able to take care of everybody. So what are the solutions? Increase the overall health of a nation, right? To reduce the necessity of leaning on that system, increase accountability of the system, and then create a wealth fund that is, of the government that can wind up subsidizing these things and then reducing taxes all the way around and having a surplus, right? So these are the things that I think are really, are going to be great. Now, what is another aspect of the system that's important to look at? This was something that I had heard about, was Mark Cuban getting into the prescription drug game, and how he had taken, look, we're going to go directly to the manufacturers, and we're going to buy it at cost from the manufacturers, and then we're going to turn around and we're going to sell it to people at a discount on, online. We're going to cut out the middleman. We're going to cut out insurance companies. So you actually can't have, insurance billing, with this stuff. And I thought to myself, well, what's the net result of this? And from what I heard, it was like, oh my gosh, some of these pills that wind up costing $500 a dose or $1,000 a dose through insurance wind up costing a few dollars, right? You look at, insulin costs, it's like whatever, 80, 100, like hundreds of dollars in the US. You go to Canada and it's a few bucks. It's reasonable, right? Well, it doesn't cost more to manufacture, right? It's just the bloatedness of the system that is causing this expense in the prescription drug arena. And so what happens is I go, wow. So if we were to kind of like, what would be the model that would allow us to, really fix this situation, is you have lean hospitals and medical facilities with accountable, like documented pricing structures, with, drugs and prescription drugs that would be, at cost, basically upon what the market would demand, without the extra bloat. Hey, listen, I think that insurance companies are great. I think that they serve a purpose, right? You're paying premiums, the collective distribution of the premiums, reduces the overall cost for everybody, and it winds up, they're really paying for sort of the outliers, but everyone's got coverage. I think that there's a tremendous amount of power in insurance companies, but at the same time, they wind up having to pay out on claims that are really sort of cloudy as to what it is that they're getting. You have tons of accountability in that regard, and then lower the cost of premiums for everybody. By the way, I don't sit here and think that I have all of the answers, but these are some of the questions that we need to start asking, is that how is, Mark Cuban and his little, prescription drug company online able to cut out 80% of the costs of, prescription drugs or whatever, that are out in the free market? This is where we start to go, oh, wow, we could start to navigate an actual, policies and structures that could create a healthy nation and make sure that everybody's covered. So this is really just meant to be sort of a wake-up call, like there's a lot of things that are broken. I don't think that, I've ever seen anyone kind of break down the problems that are existent. It's just always, look, I want the free thing. I want the free healthcare. I want the free entitlement plans. We want to be able to do that, but the way to get those things is through surplus, not through debt. Okay. And I think that that's a fairly, I haven't heard many people talk about that, but I really think that that's the way. How you would run your household, it should be the same way that you would run a country. Okay. Is your household in lots of debt? You're in trouble. You got a lot of pressure to make money and you don't have a lot of solutions. If you have a fixed income, well, that's the same thing. The country has what? Pressure to make money, kind of a fixed income, certain amount of taxes. They know that it's predictable. You cannot turn up the spending when you have a fixed income, right? And so these are the ways you have to trim the fat, figure out, oh my gosh, I should probably get rid of these, super expensive, high interest payments that I've got going. And there's ways to sort of like negotiate through that. We need to start exploring that. Could we figure out how to fix the U.S. healthcare? Yeah, but I think that the road to a solution lies down these questions. That's the road that we need to be exploring. And could there be a sane healthcare system in the United States? I really think that there could be. And I think that, therein lies the solution to having free healthcare, is figuring out a way to cut out the bloat and increase efficiencies. And you've got a real winner on your hands. So How do you feel about the current healthcare system? Am I touching upon some nerves here and making some points that, maybe you haven't thought of before? What do you think would be the ways in order to be able to, to create, a healthcare system that is robust and flexible and not overpriced and accountable? Are these something that you think that, the country should be looking for? Are these solutions that we should be searching for? And what do you feel is the ideal healthcare system? How do you envision that would play out? Or are there any points that I've missed? I'd love to hear, some of your comments. I'm, to be honest with you, I'm excited. I think that the way to a solution is through discussion. And I think that this is one of the things that we need to discuss is like, I know there's a need. We talk about it, and we talk about the fact that we want to be able to make sure that we can take care of ourselves. The biggest concern right now is, got an aging population, making sure that, our parents are going to be taken care of, and any, crazy illnesses that we wind up, having ourselves, that those can be covered as well. But, what are your thoughts on the matter? So these are just some of the things I'd like to open up for discussion. But, if you feel like I've touched on some stuff that is important and exciting to you, well, make sure that you hit the like button. If this has been valuable for you, make sure that you hit the subscribe button to make sure that you have some access to additional content, and turn on the notifications so that you are the first to be notified as soon as we have some new content on the Coleman Nation. So appreciate you. Thanks again, and we'll see you on the next episode. Take care.